In Ellis County, Baylor, Scott and White, Waxahachie is truly a pillar of the community. Patients and the general population look at our hospital when it comes to some of the most simple things of having a cough or a fever to even some of the more complex, both medical and surgical conditions that they may experience.
Waxahachie is a community that continues to support the things that it cares about. We're the perfect place to expose residents to a faith-based approach to medicine and to our community at large.
Our residents will be rotating at Baylor, Scott and White, Waxahachie, at Hope Health Clinic, and for their inpatient pediatric rotation, they will rotate at McLean's Children's Hospital in Temple.
Hope Health is a federally qualified health center. We see all different kinds of patients, from patients who are insured and patients who are not insured. We live in a community that has a significant amount of need. That means that you're going to see a lot of chronic diseases. You're going to get a lot of exposure to social determinants of health. You're going to see patients of all ages. You're also going to get to see how that patient's health affects the family as a whole. So our goal is to treat the whole patient and their family.
Our residents will have a robust inpatient and outpatient clinical experience, but just as important is the academic experience they will have. We will have daily morning report to discuss patient cases and weekly didactic sessions, which will include conferences, lectures, journal clubs, hands-on training sessions, and simulations. The curriculum has been built to combine foundational training through rotations and longitudinal experiences so that the resident will feel confident to provide full-scope family medicine upon graduation. This will provide flexibility for the resident to build their own clinical experience through elective rotations with the guidance of the core faculty.
Ellis County is growing by leaps and bounds. We're seeing hundreds of people actually move in every week to the county. You can get what you would get in a bigger city, but in a smaller, more community environment, but you're not going to be lacking for anything when you live here in Ellis County and Waxahachie.
During your residency training, you want to be exposed to as much as possible. Here at Waxahachie, it's south of Dallas, and so a lot of other cities and counties around the area, a lot of them don't have major primary care clinics or big hospitals around the area. So we have patients from a very, very wide range coming strictly here to Waxahachie to seek care. And I think anytime you have something like that, it exposes you to great training, great opportunities, new cultures, and it all helps establish your training.
It is important for the residents to have a comprehensive experience taking care of very acutely ill patients, critically ill patients. You get to rotate with the interventional cardiologists, you get to rotate with the vascular surgeons, with the urologist, be in the GI lab, be in the IR lab, and you'll get a comprehensive experience without having to go somewhere else. We really want you to feel like there are no limits to what you can do when you come to the residency program here.
You know, if you want to be a doctor in a town that appreciates physicians, this would be the place to be.